Hi, everybody. Welcome. My name is Mike Cook. I'm Director of Analytics on the Customer Insights team here at Arcadia. Thank you so much for stopping by our booth for this bite-sized booth talk. Today, I'm joined by two of my colleagues from WakeMed Key Community Care. I'll pass it over to them for quick intros.
Hi, my name's Erica Robinson, and I'm the Director of Population Health and Performance for WKCC.
And I'm John O'Neill. I'm the Director of Analytics and IS for WKCC.
So we're going to be talking today about the Arcadia Provider Strength Score. One of the most exciting things about working at Arcadia is the ability to work with some really brilliant colleagues, both on our side of the desk and on the customer side, around some new novel analytics, and this is one of them. So the Arcadia Provider Strength Score quantifies the relationship between a patient and any providers that they see for primary care services. Could be one provider or could be multiple providers. It's an entirely utilization-based score, and it looks back at the most recent 3 years of utilization data and applies more weight to more recent utilization events. The providers included in this table may or may not be the attributed provider for a given patient. Now, we've done some cross-customer analysis here at Arcadia on the impact of a strong provider's strength score on various outcomes. And we found having a good provider relationship with a patient has positive impact on cost of utilization, specifically avoidable emergency department visits, as well as on risk and quality. So we'll be looking at that today. I'd also like to mention that this data from the provider strength score exists both in Foundry as a table, provider strength, as well as in our Vista dashboarding product. Vista are business intelligence dashboards, and we have two of those devoted to the PCP strength score. One is more of an overview, talking about defining the score and what it correlates to, and the other one is more operationally focused, allowing you to put this into practice and inform provider conversations. So as I mentioned, we've seen a positive correlation between having a strong connection to your provider and lower rates of avoidable ED utilization. Here in the bottom left, we're grouping our population into two groups. Those we consider single provider, and that means that they're getting 75% or more of their primary care utilization through one provider, and then the rest who we consider as multiple provider. Now, the slides that you're going to see here from Arcadia are based on a cross-customer analysis that we did, nationwide Medicare ACO plans, and this was based on calendar year 2021 with the provider strength score measured at the end of 2020. Along the x-axis, you have your different HCC risk buckets. So your healthiest population to your more acute population at the right end. You do see avoidable ED utilization increasing across that spectrum, as would probably be expected. What's more of a standout to us is that key difference between utilization in the single provider versus the multi-provider buckets. And we found that across all of these risk bands, from your healthiest to your sicker population, those members with seeing a single provider for PCP services were between about 13 and 30% lower in their avoidable ED utilization, which is quite impactful. With that, in the next slide, I'm going to pass it over to Erica and John to talk about how they would action on this with provider conversations and in-office staff.
Thanks. So I, in my role, work more in the Vista dashboard. Foundry is John's wheelhouse, and I'm not interested in that side. I like it when I can just filter, export, and model. So one big thing for us when we're having conversations with providers and practices is that we have to tailor those conversations. We are a joint venture between a hospital system and a large independent physician association, and it's about a 30-70 split with PCPs, so 30% on the hospital side, 70% on the independent side. And so, our main focus is generally on the independent side because the hospital side they're constantly getting reports, they have access to data. So we really work with our independent practices. And so when we're tailoring these conversations around the PCP strength dashboard for the providers, we're utilizing Vista a lot, because the providers want to see the who's, the what's, the where's, the why's. And so when we're utilizing this, when we're looking at the PCP strength dashboard and we're talking about their ED visits for the last 12 months, as collateral, we use the emergency department dashboard. And again, that's just offering transparency into that patient population. But from the strength dashboard, it really gives the provider an idea of, okay, what's my relationship with this patient? You know, do I have a very strong relationship and they have high ED utilization? Do I have, you know, less of a relationship with this patient and maybe they have high ED utilization? So it really sets the tone for those conversations, and it allows for the correlation between their relationship with their patient. No matter how good that PCP thinks it may be, this puts it into perspective for them with all of the data that's compiled. But when we're talking to the practices and their support staff, we're having a very different conversation than we've had with the provider. So we're utilizing the Web UI ED high utilization report for them, because we're showing them in the PCP strength dashboard, okay, here are your low touch patients, here are your high touch patients, here are your strong relationships. Let's focus on these weaker relationships and kind of start building people up. And so when we're having those conversations, because our practices only have access to Web UI, so we want to leave them with an actionable report from what we've discussed. So we direct them to use their high ED utilization report. And again, working on educating patients, communicating after hours protocol, communicating same day appointments, whatever their access may be. So it's two very separate conversations.
Yeah, and from the data side, I think we're really happy with this new dashboard because it was already in our thinking about what to do about avoidable and non-avoidable ED, right? And our board really wants to look at that. We have aggregates across the years for each product we use, but it was just too high level. So it doesn't really work for the PCP if they're looking at the whole ACO and saying, oh, we've seen a reduction in avoidable risk, or ED visits, but what about their patients and population? So this dashboard really helped us a lot to kind of connect that high level thinking into like what they're actually seeing on the ground. And we're actually, because of Vista self-authoring, we're able to like go into the dashboard that was created for us, the SQL code, and kind of look at the actual data, how it's being compiled. And we're thinking about new ways to kind of connect these ideas together. We like the PCB strength dashboard a lot, but we think we can probably index a little bit, weight it more on actual population size, panel size, so that you're not comparing apples to oranges with populations across products. And so then that allows us to give them better insight on the overall what we're showing at board meetings and meetings in general of aggregate and how it connects to themselves. And then we can go in the field with Erica's people, and then we can show them these new dashboards. How does it help them? How does it help the providers understand their patients? How does it help the office support staff? And then we're just going to keep developing more and more tools. This allows people to access their data a lot more usefully, and will then increase their data literacy, so we can actually expand more and more uses of Arcadia and how we can use this data to impact patient health.
Thank you both for those insights. And I should mention that WKCC, Erica and John's team, served as preview partners for the PCP strength dashboards that we built and give us a lot of really helpful feedback in the development phase. And that's something we do with all of our reporting products. We like to get them in front of customers, a few beta customers before they go fully live, and we get some really great ideas on novel workflows through that process. Now, I mentioned that the strong provider strength correlates to lower ED utilization as well as to better risk closure and better quality performance. This side focuses on risk. We see in the green bars for each HCC risk band there in 0.5 increments, your percentage of risk closure for those members who had a low PCP relationship, and then in the purple bar above, the additional percentage of risk closure for those with a high PCP relationship. And so up to about 1.0 on the HCC risk scale, it's a moderate positive impact. But then you see after 1.0, it really does grow to be a significant additional 7 to 9% percentage point increase. And if you're doing a percentage difference, it would be even more significant there. So really impactful. And again, this study did focus on Medicare ACO populations, but the provider strength score has impact and applicability regardless of contract type. It's really a measure of your connection to your customer, and there's so many positive impacts that flow from that. In this presentation, we're focusing on just these 3 areas, but there's really so much more that we can do with it.
Okay, so in the PCP Strength dashboard, when we're looking at the risk, and apologies, I probably should have expanded my screenshot to show the engagement level with the patient, but we all hear it. How are you recapturing risk? Are you capturing every condition to the highest specificity? Are you compliant with recapture rates? What are you doing? So this is a really great example. And so in the dashboard, it's really nice because you have the patient-provider engagement level, and then you have the open risk. And so this is also another level setting conversation with providers to say, okay, well, you have this very strong relationship with this patient. Let's talk about why there's so much open risk. Let's talk about those patients. Let's talk about all your high-risk patients, but let's start with your most engaged high-risk patients because you're going to be most likely to be able to get them in and get them on the books, get that taken care of, and on with their day. And then you can focus on the less engaged patients and try to work on building that engagement to capture all of the risk. So again, when we're having these conversations around the strength dashboard, the dashboard that we use as collateral is the Vista Risk Navigator dashboard. I love this dashboard. I think it's very helpful for providers. And again, offering transparency into high-risk patients and the populations. So then from a support staff view, we are discussing the high-risk patient report in Web UI. So again, catering to their access of Arcadia and things that are impactful for their practice. And we also have trained them on the Web UI risk browser report, which is another really great report. And again, we advise, know your patients, call your patients, get them scheduled for their annual wellness visit, those PEs, and the week of their appointment, start prepping for their visits. Make sure that that open risk is lowered and that you're recapturing all their conditions.
Yeah, in our data models, we have a few that we use to look at population health segmentation, acuity levels, even some modeling on cost. Risk is such a huge variable. It's the 3rd most important one in our population health segmentation. So it says a lot to the acuity of the patients that you're dealing with, and can just give you a lot more information of what your population looks like. So we use it a lot in a lot of our models, and so to have this conversation of like, who are the people of higher risk and don't have the best strength of relationship with their providers allows us the starting point of like, here's who the people we need to really start working with so we can get them in to try to close these gaps, because risk is just across the board in every model we run. It seems to be a huge indicator of bad performance or lower cost or higher cost or lower closing of measures. So we really kind of use that as a way to fixate on the doctors that might be dealing with patient populations that have higher acuity, might need more services, and so we can go after them first. So this correlation that you guys are seeing in your data really kind of shows up in how we work with our data and our data models, and that helps then Erica go out to the field and identify and work with the providers to get these patients in. And that's the most important thing.
And I'm going to add one more thing. So a lot of times these conversations are very humbling for your providers. In every provider's mind, they provide the best, highest quality care for their patients, and it's absolutely true. But are you capturing all of the work that you're doing, all of that amazing quality of care that you're providing for your patients? We want to give you credit for it, and so it's always a very humbling conversation with them, but as time goes by, it's getting a little bit easier. We have kind of an older generation of providers on our independent side, and so they're very resistant to change. And they've been in practice 30, 40 years. They have the same patients for 30, 40 years, and so they have a much more chronic population at this point, and so their patient dynamics and their patient population in general is just progressing as well. And so this is a great dashboard to leverage when you're having those conversations.
Thank you both. It's great to see the kind of conversations that these data points are leading to, and also to better understand some of the challenges of those. So as I mentioned, the 3rd area of major impact that we see with a strong provider relationship is on quality. So this slide looks at your quality performance compared to a baseline, which is the average quality performance for the population. And here we're segmenting out the provider strength score, not into just a strong or weak, a high or low, but into 6 different buckets. So we have none, which is the group with no primary care utilization at all in the prior 3 years. And then we have an extremely low to extremely high spectrum of 5 additional buckets there. And you can see there's really a strong linear relationship, a positive linear relationship between quality performance and that quality of the PCP strength relationship. With that, I'll pass it back to Erica and John for one more slide.
That's one thing we don't necessarily utilize the PCP strength dashboard for. And I'm going to toot our own horn. We are generally one of the top, if not the top, ACO in the Southeast consistently on an annual basis. And so we're really focusing our time and energy with our providers on our areas of opportunity, which are around cost. So we're really looking at ED utilization. We're looking at risk. We're looking at panel management. And so again, I mean, the PCP strength dashboard just naturally speaks to panel management. You see your engaged patients. You see your non-engaged patients. You know what you need to do. So it's very helpful. We've had really great success with it, especially around the provider discussions that we have. Again, just knowing who are your most engaged patients, who do you need to work on, who is a high ED utilizer that is engaged, who's not, because then those conversations can be tailored with those patients and those discussions can be had. So from an office support staff perspective, again, working with what they have, so they have web UI, so we work with them in the strength dashboard, and then we direct them to the patient registry report, which is a great all-encompassing report that really does allow them insight into their populations around risk, ED utilization. I mean, it pulls in vitals, it does all the things. And so they also find that very helpful when we're talking about panel management.
Yeah, I guess my final thought on that would be, we don't, as you said, we don't use this for the quality measures, but what I really like with the dashboard is I think it's easy for the providers to understand. It allows them to kind of dip their toes into data a little more than they have in the past, understand how their actual relationships with their patients can drive so many other factors and the more they can do that, the more they can build their data literacy up, and that's really, really important for us. Arcadia has this great platform, has tons of data, but a lot of people are just like, I don't know where to start. And if we can focus on just, here's your relationship with your patients, and here are the ones that you might want to reach out to more, get your support staff to work with more, and they can see the outcomes improve for quality measures for risk. Based on that, they're more likely to go back and say, okay, what else do we have here that we can look at and identify areas that we could work on, or that things that we're doing really well. And so I think that's the strength of this dashboard so far, is that providers understand it. They get it, and then they can start working more with Erica's team on different ideas using different dashboards, and that really kind of helps them utilize this tool that we have that they pay for, that they should be utilizing as much as they can, and they can develop workflows off this much more effectively if they understand and really have data literacy that works for them, right? That they can actually use in their workflows. So that's why I really like this dashboard, and like a lot of the stuff that you talk about, it has so many strengths to other parts of data that we really, it's a good entry point into understanding your patient population, risk, and quality measures and stuff like that. So that's great.
And I'll add one more thing, because apparently that's what I do. So Arcadia has really opened so many doors for WKCC, for our practices. It's more transparency than they've ever had into data. And it's a ton of data. It's a ton of data, but it's all about how you parse it out, how you identify what meets your organization's needs, how you identify what meets your individual provider needs and your patient needs. And Arcadia has given us that tool where they have just different dashboards on different platforms that work together to provide the information that you need in a ingestible format for your audience. And so I know our providers, while they may grumble a lot, because these are very painful conversations to have sometimes, because in every provider's mind, they are the lowest cost, they are the highest quality, they are taking amazing care of their chronic patients. So they don't like to see the data. The data's obviously wrong. That's what we always hear. But it's it's better to have those painful conversations now instead of 5 years down the road when value-based care is in a much different place. So we have Arcadia to thank for a lot.
Well, thank you so much for joining me for the talk today, Erica and John. It's always a real pleasure to see what customers are doing with Arcadia's products, to better understand the customer perspective, to see where we're succeeding and where there are some challenges that we can address.